Hi everyone, Dr. Amy from Pain Free and Fit. Today we're going to be talking about how twisting your upper body using your arms can actually help to reduce your lower back pain while you walk. Fresh out of my book, Walk Away Back Pain. Hope you enjoy. So continuing in part 3 of our 5-part series on twisting and lower back pain while walking and how it can help reduce your lower back symptoms, we're going to focus today on the upper body, shoulder or torso rotation. In previous parts 1 and 2, we talked about engaging the core like an elastic recoil while we walk to help with lower back pain. Part 2, we talked about hip twisting. Today we're going to talk about the opposite of hip twisting, but shoulder twisting. Many times with lower back pain, especially with disc problems are aggravated by flexion or bending forward. And a big part of lower back rehabilitation that doctors as myself and therapists work on is extension of the spine or bringing the spine upwards, particularly the mid-back, to prevent that forward flexion, which then compresses the front of the disc and leads to lower back symptoms. If you sit during the day, if you're working, computer use, desks, many times driving, you're going to have a lot of compressive loads. And one of the nice things about getting up and walking is it actually helps to use the latissimus muscles, which run from our shoulder down into our mid and lower back. And these muscles help to extend or bring us up. And a good part of any good lower back rehab program helps to strengthen the endurance and the overall strength of latissimus dorsi muscles. So we're going to use this concept to self-rehab our back pain while we walk, and we're going to plug it into a correction for any asymmetry we may have. So we're going to kill 2 birds with 1 stone on this one today. So, to begin with, analyze your rotation of your upper body. As you stand with your feet straight ahead and your pelvis level without twisting your pelvis, you're going to rotate your shoulders or your chest, your upper back, upper torso, right and left. And typically what you're going to find, because we all have asymmetrical postures and movements during the day, we like to sit, turn more to one side than another. One side is going to feel more flexible than another. In my case, I can turn, you can see, a little bit more to the right than to the left. I feel a little limited there. What that means is that I spend more time twisting to the right with my upper body during the day and night than I do to the left. That impacts my lower back, because what that means is the side that I twist towards more, that latissimus dorsi muscle is going to be tighter. It's shortened. It's used to being in that position more. And the opposite way, it's going to be tighter to move that way to stretch that latissimus dorsi. That asymmetry in latissimus dorsi function from right to left side has an asymmetrical pull on my spine and thus can affect lower back pain, may be part of my symptoms. It also, the side that is stretched or long is going to be weaker. It's going to have less of an ability to extend or bring me up, which is going to impart the flexion forces on my discs and many times aggravate low back pain. So, whether you have disc degeneration, disc herniation, even spondylolisthesis, scoliosis, any type of arthritis in your lower back, you want to make sure that these muscles are symmetrical from side to side so you're not pulling and mechanically stressing lower back pain. So let's plug this into our walking cycle. As we walk, we know that as the hips twist one way, the shoulders twist to another. So if I'm limited in twisting, let's say, my chest to the left, I want to accentuate that. When my opposite leg comes forward, let's say my left leg comes forward, remember I want to accentuate into the tighter side. I can't twist as much to the left. I want to accentuate bringing my right arm and right shoulder, but accentuate the shoulder first, allow the arm to follow the shoulder, twisting to that left side. Every step I take during the day then is going to help to engage my latissimus muscle on the left side, which remember was typically weaker on that side. The other side was stronger because I'm always twisting that way. And as I do that, as I engage my left lat to help along with abdominal oblique muscles and other muscles involved in this asymmetry, I'm going to help to start restoring that pattern of twisting my chest to the left. So every other step that I take while I walk around during the day, in the office, at home, on my fitness walks, I'm going to be thinking about just allowing that right side of my chest and shoulder to come forward a little longer, allowing that left arm to swing back a little further, allow it to stay back just a split second longer than I usually do. That, every step I take during walking, is going to accentuate that left rotation. Far better than just trying to stretch during the day to the left, although that can be helpful. This is a repetitive loading cycle that not only strengthens these weak muscles in rotation, but helps to simultaneously stretch the tight muscles, bring your upper body back into balance, and decrease the stress on your back pain. If you'd like to help me share this valuable information with others, give me a thumbs up below. Questions or comments, write in. I'll do my best to answer them. And if you're looking for more great videos on how walking and other supportive self-management exercises can help with your back pain, check out our videos by subscribing to our channel here at painfreeandfit.com. And remember, if you're looking to customize a program through walking and other therapeutic exercises to help with your lower back pain, regardless of diagnosis, check out my new book, Walk Away Back Pain. It has over 200 pages chock full of walking tips, walking exercises, supportive stretches, psychological and mind techniques to help with chronic pain to reestablish a more normal working central nervous system as it relates to pain. We talk about nutrition. We have all kinds of other posture tips in it. It's probably the most jam-packed book in terms of self-managing lower back pain available today. I hope this video on upper body twisting as you walk helps you with your chronic lower back pain.